Welcome, everybody, to the WellSprings Home Care Podcast. I'm your host, Justin Curry, and as always, I'm here with my two four-legged co-hosts, Goose and Remington. WellSprings is located in Exton, Pennsylvania, and we've been around for a little over 2 years now. Some of the services we offer include live-in care, so that's when somebody actually will come in and live in the home with your loved one. We offer personal hygiene services, helping out with, brushing your teeth, washing, things like that. We offer dementia care, Alzheimer's care. We have caregivers that are certified and trained specifically in those areas. And companionship services, whether somebody just needs a friend or needs somebody to talk to, we can do that, in person or over the phone. We offer care for veterans. We offer personal care, like helping out with the activities of daily living. This can include things like toileting, bathing, washing. We also offer respite care. If there's a family member that's currently caring for someone, we can come in and just sort of provide them some relief so they can have a break as well. Another thing we provide is mobility assistance. So any rehabilitation, maybe there was a hip replacement, maybe they're just not able to move around the home quite as easily as they used to be. We can also come in and offer meal preparation and even light housekeeping from time to time. That's things that you're going to do on a daily basis, like dusting, doing the dishes, maybe vacuuming, putting away dishes, things along those lines. So today what we're going to be talking about is obviously the COVID-19 crisis. We've had a lot of questions come in regarding home care services, what we're still able to do. Home care agencies such as WellSprings are considered an essential provider, which means we are a life-sustaining provider and can continue to offer services. So we're still fully operational. We're still helping out clients at home. That's obviously most of our clients. It's critical that someone is there to help them. So we are still fully operational. But what I wanted to talk to you about today is just sort of what precautions we're taking and what certifications we're taking. Obviously, working with seniors, I think seniors are about 95% of WellSprings clientele. We do have another 5% that's, those with disabilities that are a little bit younger. And we have quite a few clients that actually have autoimmune diseases as well. So as you can imagine, this makes our population, our clients, extremely vulnerable and extremely susceptible to this virus. So we're taking every precaution necessary, and we're going to chat a little bit more about that now. So how we're keeping our clients and our staff safe during this coronavirus pandemic. First of all, we're in very close communication with the CDC, which is the Centers for Disease Control and Prevention, as well as the World Health Organization and also the Department of Health. So we're basically taking their recommendations and we're applying that to all of our staff. We've also we've partnered up with the Care Academy, which offers now a COVID-19 certification. It's about a half-an-hour course, and it covers everything from precautionary measures to what to do if you're having symptoms or if you see somebody else that's having symptoms. Basically covers all grounds, as well as personal protective equipment, and just sort of gives the caregivers a general overview of the disease and how to deal with it. So some of the ways that we're keeping clients and caregivers safe. Number one is personal protective equipment. So these are things like latex gloves, masks. We're trying to order hand sanitizers. It's obviously on back order for I think everybody now, but we have several shipments coming in that we're going to try and get out to our clients right away here. And other things are just reviewing our policies and procedures. We've had several policies come up in place to address this issue. And then also, that includes the recommendations from CDC, and that's been provided to all of our staff with the addition of the certification that they've taken. Any of our staff members, they're all working from home, so everybody's working remotely right now with the exception of the caregivers who are obviously, critical to be in the home of our clients we're caring for. And also another thing we've done is we've informed our caregivers what to do if they've had an exposure, or if they're having any symptoms, or anything related to the disease, is to contact management immediately. And we had one case that the caregiver got in contact with us. She was seeing some symptoms, so we pulled her off the schedule immediately, and we actually had her tested right away for coronavirus, and thank goodness she's okay. And the doctor gave her an order to stay back for 2 weeks, and not to expose any other clients, just in case, for precautionary measures. So she's been taken off the schedule, and until the doctor gives us the go-ahead, she's going to be at home for the time being. And obviously, this is a progressive situation, so the CDC, Department of Health, they're always providing new information. So when that happens, we're basically putting together emails, we're adding to the policies, and we're updating our caregivers and staff kind of as things progress here. Another thing we've implemented is telehealth. So what that is essentially we're making phone calls to some of our clients, especially those that are isolated, some that might be at a fall risk. We're making extra precautionary calls. We've been in touch with their families to see, exactly what time of day and when they want us to call them. So we've really extended that service as well, and it seems to be really helping out with even different things like medication reminders, and just ensuring the overall safety of our client. And some of the other things that we've done is just informed our caregivers of, precautions they need to be taking, when they're not on shift. So obviously we don't want them out in public places. And, that's a bit of a taboo thing, previously to this disease is, their personal life is their personal life. But with this disease, they all fully understand, the severity and how critical it is to keep themselves safe and healthy so that they can kind of care for our elderly population. And we haven't had any pushback on that. They've all understood, they're going out only for necessities. They obviously don't want to be exposed either. And some of the tips that we've provided to our caregivers are just avoiding close contact with anyone who is sick. We're just trying to, keep that 6-foot distance as recommended. And we let them know as well, just don't touch your face, especially when you're out and about. You've been in a public place, or you've been working with a client. You don't want to touch your mouth or anywhere you can ingest any of the germs to expose yourself. And obviously we had touched base on that a little bit before. But staying at home when you're sick. So obviously, if we have anybody that's showing any symptoms at all, any flu-like, cold-like symptoms, we keep them at home and have them tested. And then disinfecting. So we have our caregivers all have Lysol wipes that they're taking out to the homes, and they're basically disinfecting everything from their car door when they're getting out to the client's doorknobs, bathroom doorknobs, sinks, anything that's multiple people are touching. We obviously want to keep that disinfected. And if there's any coughing or sneezing, we want to make sure that that's contained. Always cover your mouth. Throw away the tissues immediately, wash up right afterwards. And as far as wearing a face mask, the CDC actually does not recommend that people who are healthy actually wear the face masks. The people showing the symptoms, they recommend actually put on the face masks. So we don't have anyone who does have symptoms in the field. So they basically, nobody's wearing face masks unless their own personal safety measures. So in summary, I just wanted to let you know that WellSprings Home Care is taking all necessary precautions. We are still operational. If you have somebody that's isolated or that needs help, we can definitely send somebody out right away. You can also go to our website at www.wellspringshomecare.com, and that's an S on the end of WellSprings. And we have a COVID-19 certification that's listed right at the top of the website that just indicates that all of our caregivers and our staff members have been trained, as extensively as they can be at this time. And we're still doing ongoing training just to make sure that, just to protect our clients and our caregivers. So I hope that provided you a little bit more information and a little bit of clarity regarding the COVID-19 virus and home care services. WellSprings Home Care is in full compliance at this time, and we can always help out. So give us a call anytime, and we'll be updating the situation as it progresses here. So thanks a lot for listening, and we'll see you again soon.